The shoulder joint is one of the main joints in the human body, and there's a lot of muscles, tendons, and ligaments involved in the shoulder. Any one of those could be leading to a potential shoulder injury or shoulder pain that you might be dealing with. The shoulder joint is what's known as a ball and socket joint, where the ball of the head of the humerus, the arm bone, fits into this cup, this socket, which is part of the scapula or your shoulder blade that runs along the back, creates this cup here. The hip is similar to the shoulder in that it's also a ball and socket joint, but the shoulder is unique because it's such a shallow ball and socket joint. That means there's not really much of a socket, and that ball can move through a way larger range of motion so that we could reach all the way overhead, out to the side, behind us, all these ranges of motion. Now, with all that mobility that we get from having a shallow socket, there's a trade-off in that there is an increased risk of injury because there is decreased stability in the shoulder joint. So to help with the stability, we've got lots of muscles and tendons attaching across and to the shoulder joint to help our arm move in all these different directions. So we've got two kind of groups of muscles that you could say for the shoulder. We've got the internal shoulder muscles, and those would be directly the rotator cuff and the deltoids. Rotator cuff are the four deeper muscles that are right around that ball and socket joint. Those would be the subscapularis, the teres minor, the supraspinatus, and the infraspinatus. If you want to know the anatomy, that's great, but just understand the bigger idea of these deeper layers of muscles that really help with these small movements and the stability of the shoulder joint. On top of the rotator cuff, we have the deltoids, where you have the anterior, the medial, and the posterior, so just the front, side, and back of these outer shoulder muscles. In addition to these muscles directly related to the shoulder, we've got all these other muscles that run across or attach to the shoulder joint. So you've got biceps, triceps coming from the arm attaching up into the shoulder, and then you've got things like the pecs, the lats, the deltoids in the back. You've got the traps and the levator scapulae and the serratus. Basically just this whole network of muscles, tendons, and tissues that intertwine with the shoulder joint that can all be related to creating stability and be related to your shoulder mobility and also the lack of shoulder mobility. Again, if you want to get caught up in the anatomy, that's great to understand all the muscles that are helping your arm move in different directions through the shoulder joint. But the bigger picture I want you to take away is that the shoulder can and should move in all these different directions. And if we have pain or an injury, it might be because the shoulder can't move in certain directions, and we should work on helping our shoulder move into those areas. With that said, let's dive into the different motions that a shoulder can move through. Your shoulder is capable of moving in any really direction because it's such a free moving shoulder ball and socket joint, but we're going to break it down into very precise movements so that you can isolate the movements and really understand which direction you might be limited in. First, we're looking at flexion and extension of the shoulder. Flexion is when the shoulder contracts to raise the arm up in front of you, and extension is when you lower the arm down and lengthen out that deltoid or that shoulder muscle. Another type of flexion and extension is horizontal flexion and extension. So flexion horizontally would be across my body, across the midline, and extension would be bringing it out away from me. So that would be like a fly or a reverse fly out to the side. Along with flexion and extension, we also have hyperextension, and that's really just the arm reaching behind the body. So coming from beside the body, going backwards behind, and then returning back to the midline. Next is abduction and adduction. I like to think of abduction as you're being abducted, like an alien, away from your body. It's pulling something away from your body. And adduction is it's being added. It's being brought back into the body. This is really similar to the flexion and extension, as it's contracting the shoulder in both directions, but we do call abduction and adduction probably when it's out to the side. Next, we have rotation. So that would be internal and external rotation. So if you can see through a bent elbow, shoulder rotates in, and then rotates out. And you could also do that with a straight arm or in any direction really, but you're getting that pivoting, that spiraling of the arm bone of the humerus inside the socket. And the last one kind of puts all these pieces together, called circumduction. And that's just being able to create circles, forwards, backwards, combination of all of these moves put together. Again, very few things that you're going to be doing are purely moving through just a single range of motion. It's going to be a combination of all these things, just like circumduction shows you. But it's good to understand what the shoulder is capable of and test your limitations so that we can use the exercises to follow to really help build a complete shoulder that can move through all these directions. All right, onto the exercises. First up, we've got a front and a lateral raise. Here I combine them so that we can talk about both of them together because they're similar movements working a similar pattern. Although we talked about it's a flexion and extension to the front and an abduction and adduction out to the side. Lots of variations you can do this one, or palms down, thumbs up like a neutral, or palms up, a supinated position. So this would be flexion, extension of the shoulder, or abduction, adduction for that lateral raise. The goal here is not necessarily to go as high as possible, but we want to be feeling the shoulder do the engagement, do the work to lift that arm up in front and out to the side. You're going to increase the range of motion where the shoulder is involved the more that you practice this. So you might not be getting to shoulder height the first time you do it, and then you get up to shoulder height, and then maybe you're able to get a little bit above shoulder height, but the height that you raise the weight to and the amount of weight that you lift is going to be dependent on the strength of your shoulder and a bit on your anatomy as well. Another version is the prone front raise. So here I'm laying on a bench and I'm raising the weight up above my head, and this is going to work a bit more on my posterior delts because now I'm raising the weight over my head, but it's from this kind of arm out in front of me position to an arm overhead position. So I'm using more muscles on the back of my shoulder to raise the weight. One other example is the cable or banded front raise. And I like this one because it gets you that extra hyperextension behind the body that a lot of times can be neglected with training. Just the arm might come to the midline as gravity lets the weight come down. But when the cable or the band is pulling your arm behind you, you're getting a bit of that extra stretch through the shoulder, and you have to work through that range of motion to bring the arm up. In that same vein, we are looking at a row now, or as I pull the dumbbell up, I'm trying to get my elbow at least to come to in line with my torso, if not a little bit behind, so that I get that shoulder hyperextension and try to open up that shoulder. Tricky thing for a lot of rows is you can see the shoulder kind of collapse forward. So being sure to pull back if you stop at the midline of the body and you can keep your shoulder from collapsing forward, that's great. If you drive the elbow back and you find the shoulder comes forward, we're just going to stop a little bit before that and try to work up to having the posterior shoulder strength to bring that elbow back and keep the shoulder back at the same time. If we're getting that shoulder rolling forward, we're unloading the posterior shoulder and the rhomboids in the back. We don't want that. We want to be working those muscles. So just stopping at the range of motion where the muscles are helping you do the row. Same thing goes for a high pull, where you're pulling the dumbbells up. It's kind of a lateral raise and also kind of a posterior shoulder motion, where you're pulling the weight up and a little bit back. You don't want to go too high where it just turns into a shrug motion. We want to be stopping at the point where you feel the shoulder doing its job and not offloading and just turning it into a trap exercise. Next, we're going to look at shoulder rotation exercises. So here we're doing a shoulder dumbbell internal and external rotation. Lots of different versions that you can find online of this or find examples of. I like this version, and I like a few cues with the rotation. I'm trying to get my tricep flat and my armpit to sit on the bench or the box or whatever I'm resting on. If my armpit comes off, I'm starting to shrug the shoulder and I'm going to lose some of that rotation that I'm after. So if I can get my tricep flat, get my armpit flat, work on that rotation in and out, and be patient with the feeling of trying to feel it deep in the shoulder. This is going after more of those shoulder rotator cuff muscles because it is the rotation of the shoulder. Being patient, accumulating some reps, maybe 10 reps, 15 reps for a couple of sets. You're gonna feel this one for sure. I'm feeling this with just 8 pounds, but you wanna do it correctly and not turn it into a shrug where you just feel your neck or your lats or your back because you're kind of cranking yourself to the side as the weight pulls you into it. Looking at the horizontal flexion and extension, we've got a cable, or in this case, a banded fly or reverse fly, where you are getting that arm crossing in front of the midline with the flexion, and then you've got the arm coming away from the midline out to the side of the body with the extension. So something that I like to think of for the reverse fly is you're not squeezing your shoulder blades together as you bring it back. That's gonna work your rhomboids, your back muscles, but not your shoulder as much. You're trying to reach away from the body as far as you can. Like you're trying to touch your fingertips as far away as you can possibly. That's gonna get a bit more of the shoulder and not squeeze your shoulder blade back. And with the cable fly, the flexion in front of the body, if you haven't done this one, you might feel a lot of pec, like your pec's about to cramp. That's okay. Maybe just take it a little bit lighter, take a step in to offload the band just a little bit, and being careful not to just shrug your shoulder into it. We're trying to get this kind of arm sandwiching across the body feeling, stretching out through the back of the shoulder, stretching out those shoulder blades and those rhomboids across your back. Next, I've got a dumbbell pullover, and this is more meant for a mobility, but we're also looking at the strength of the adduction, bringing the arm back towards the body. So what I've done in this case is I have my feet on the bench, and that's gonna allow me to keep my rib cage down on the bench so that I don't arch my back as the arms go overhead. If I start arching my back, what I'm doing is I'm using my spine to get the mobility, but my shoulder is not actually doing the movement. So by keeping my feet up, I'm able to keep my spine on the bench and focus more on the mobility, the motion of the shoulder joint. Pick a weight that's appropriate where you can actually relax. It's enough weight that it'll pull you into an overhead stretch, but not too much weight that you just find yourself tensing up. And the last exercise I want to touch on is the shoulder press, pressing a weight above your head. Here I'm doing a seated version. And we're gonna keep the same idea with the pullover in for the shoulder press. I'm trying to keep my spine flat-ish on the bench or the backrest. As I press my arms up and bring them back down, I'm trying not to change my spine position. We're trying to focus on the range of motion, the movement of the shoulder without any of this extra movement going on. Really common to see maybe just someone locked into an arched back position as they're doing the shoulder press up and down, but that kind of just turns into more of a incline chest press because the chest sticks out more, you're getting the chest a bit more involved, and you're not improving that overhead strength and that overhead stability that you would if you could keep the rib cage down and reach the arms straight up. It's gonna come with time. Maybe you're not able to get your hands straight over your head yet, but being patient, starting with a low weight and building up is really gonna improve this and help you target your shoulder mobility. And just for fun, at the end of this shoulder workout, I threw in a bench press and a chin up because my shoulders felt great after doing this complete shoulder workout slash warm up. It's a warm up, but it's an extended warm up that I counted as a workout. And I was actually burning some calories as I was doing it. It wasn't just this easy warm up. My shoulders felt really good. The blood was flowing and I felt so smooth when I was doing these chin ups and this bench press that yeah, I felt ready to go. Not everyone is going to have time or want to do all of these shoulder exercises. It took me about 30-40 minutes to do 2 sets of all of these, and some of you might need more sets depending on if it's an area of your shoulder that you need to work on more. I think if you can extract 1 or 2 of these that would really benefit your shoulder and plug them into your program or your morning routine, you're gonna see a ton of benefit in your shoulder strength and your shoulder health and improvement in any shoulder pain that you're experiencing. If you find any of those exercises specifically help you and your shoulder issues, go ahead, take those, plug them into your program, or just use this as a great shoulder workout slash warm-up for you to add into your routine. And this is not a comprehensive, complete shoulder routine or strength program by any means, but it's more to get the concept of shoulders being able to move through several ranges of motion and the importance of training those and not neglecting them, because if we spend too much time just doing something like a shoulder press and not working on other aspects of the shoulder, you're going to see some problems. So deal with them now before you see those issues come up or get progressively worse. Thanks so much for watching. Click like, click subscribe if you want to see some more videos, and please drop a comment if there's anything that you'd like me to answer or any other videos that you'd like me to go in depth with explanations on.